When administering oral medications, there are many steps that you need to take to ensure that you are properly keeping the patient safe. So the first step you want to do is, when giving an oral medication, is you want to make sure that you start with your 3 checks. So the first check that you want to do is to make sure that you're checking the medication against the order in the patient's chart to go over any inconsistencies. When doing this, it's highly important to check the patient's allergies. So you want to check that in the medication chart, but you also want to ask whenever you get into the patient's room to make sure the medication does not have any contraindications with the allergies. Another super highly important step is to remember that when giving any type of medication, as a nurse, it is important to know the actions, special nursing considerations, safe dose ranges, the purpose of administration, the potential adverse side effects of the medication can actually cause, and also the appropriateness of the medication for each patient should be considered. Okay, so now that we can actually give the medication, I'm going to go ahead and grab the liquid medication and the pill form medication in my cup here. So we actually have Altoids, and that's going to be our pill form. And then I have my cup here, but we're going to pretend like it's still sanitary. And then we have children's Motrin. And then do you have here's our imaginary table that he will hold. And this is my lovely patient, who is also my imaginary table. Okay, so here's my cup, and you also want to only get ready 1 medication at a time. So we're going to kind of do like a 2-part little video here. So we'll do the pill form first. We'll get ready with our Altoids. So I've already checked, done my check 1 and checked the medication against the order, and I've done my hand hygiene and got the medication out, and we're pretending like I've already put it in the cap because I don't have a medication cap here. And we'll get 1 pill out. Okay, well 2. We'll check the order again, and it actually said it needed 2. So, okay, so check the order, and the order said it needed 2 pills, or 2 Altoids. Okay, so then I take this, order, and I'm going to the patient's room, and I get to the patient's room, and my 3rd check, I'm in the patient's room, and I knock on the door, and I go to the patient, and I've done my hand hygiene, and I check with the patient and identify the patient. Can you state your name and date of birth, please?
John Smith, January 1st, 1990.
Okay, and that matches the patient's chart in the order for the medication. So I make sure the patient's setting up properly to ensure safety so he does not get choked, and I offer him water if he needs it for his pills. Do you need water to take your pills?
Sure.
Okay, do you have that over there?
I do.
Okay, great. Do you want these in your hand or in the cup?
In my hand.
In your hand. Okay, so I'll dump these into his hand, and he can actually take them because it's mint, so you go ahead if you want. Okay. All right, and I have to make sure that they're swallowed before I leave the room. So if you can actually take your... Are they gone?
Mm-hmm.
Can you open your mouth and prove it? Can you lift your tongue up? You can't hide your opioids in your mouth.
You just swallow them.
You're going to have to figure it out. You can't. Okay, open your mouth. Are they gone? Good boy. All right. Okay, so once I make sure they're gone, I document in real time. And then that is to ensure that in case the patient has any adverse effects or anything, we know when they've happened, and that way we know when the next dose is due, and then we can come back and evaluate when necessary according to the medication. Okay, and here is the table once more, because now we're going to do the liquid medication. So go back into the room, and I've already done my first check and my second check because I've already done, we'll pretend like I'm dumping it again. But I've already dumped the children's Motrin in here, and I've checked it, and it is 1 teaspoon, and that is what the dose was. So then I put it back, and I've done my hand hygiene, checked for allergies, and I go back to the room, and can you state your name and date of birth?
John Smith, January 1st, 1990.
Okay, and did you actually have any allergies?
No.
No? Okay. Do you need a drink or anything? This medication actually, you have one?
I do.
Okay. Could you take this medication, please? Don't actually take it. Okay, great. Thank you so much. Okay, and since he didn't have any allergies for either one of those medications, we're great, and then I would document the medication and come back and evaluate whenever necessary and make sure the patient's comfortable. Are you comfortable? Do you need anything? You're fine. Okay, great. Thank you so much.